typical ones that everybody's probably used to is the Oswestry questionnaires. So they have ones for every part of the body, and we use them in clinic all the time. If you've got a brand new patient or you've got an existing patient with a brand new injury that they're coming in with or dysfunction, then we'll start them with that questionnaire, and then it's just a matter of every 3 weeks or every once if depending on how often they're coming in. Typically it's about every 3 to 4 weeks we'll run through the questionnaire again, and the questionnaires are all really well laid out so that you can actually compare both of them and you can get a score to see if what the outcomes are, if you're actually having improvements or if you're not having improvements. And if you aren't having improvements, then you do a reassessment, and what are we missing? Do we need to refer you out? So they're just great questionnaires to go through. So I included them in the book. They're going to be for those people that do purchase the book when it goes online, they'll also get access to download those questionnaires as a PDF so they can start implementing them into their practice. And again, these are questionnaires that you'd have to go out and search everywhere and try and find out if it's actually if there's any validity to these questionnaires or not, because there's a lot of questionnaires that are just crap, to be honest. And they don't have any validity whatsoever. They don't measure anything, and it's just a waste of time. So I not only got the questionnaires, but I went through and I found the research that assessed the questionnaires for their validity, and anything that showed that it wasn't valid, well, then I didn't use it, obviously. So these are the ones that have the most validity in use in clinical practice. And I still practice clinically. I still am in the practice, 3-4 days a week, still seeing patients for an hour at a time each. So I think it's really important. I like how the clinical practice supports the teaching and the educational aspect of what we do, and the teaching and the educational aspect and the research and the science, and of continuing to, try and be as forefront as possible. It contributes to the clinical practice. So you have to have both.